Thank you, Angela, for that kind introduction, and it's fantastic to be here today. I was asked to give a little bit of a viewpoint from the perspective of the European Patients Forum on sharing of data. And first of all, maybe a little bit about the European Patients Forum for those of you who don't know us. We were set up back in 2003, and I'm pleased to say that Alzheimer Europe was among our 13 founding members. Today we have 74 patient organisations, umbrella organisations, European-specific and national patient coalitions from very many of the EU member states, including here in the Netherlands. Our vision as an organisation is that all patients with chronic conditions in Europe have equal access to high-quality, patient-centred health and related care, particularly social care. And our mission is to be the collective influential patient voice in European health and related policies and a driving force to advance patient empowerment and patient access in Europe. Those are the two major pillars of our work, and of course digital health and data are very inherent to both those arenas. Historically, we've done quite a lot of work in this field, and we heard a lot earlier with the excellent presentation on the General Data Protection Regulation. We accompanied it through its legislative journey, and interestingly, did a lot of work in the European Parliament because this NEMIS concept was very, very prominent there. The MEPs that were trying to make a decision about GDPR were actually being overprotective, and if some of their proposals had gone through, it would have actually stymied and prevented health research in the future. So we did our bit at that point. And then the other thing on GDPR, it's an ongoing dialogue with our members and their members, but we try and provide guidance and reflection on an ongoing basis, and published a comprehensive report just after the adoption of the legislation, so patients knew more or less where they stood, although of course there were national derogations and so on that we still need to take on board as well. We've also been very involved with the European Commission with regard to their reflection on digital health, and I'll talk a little bit about their communications in a moment on digital health, but we've been very much influencing the idea that when we're thinking about digital health, when we're thinking about technology, it shouldn't be purely technological driven. It should actually have a purpose and actually respond to an unmet need of patients, of citizens out there. Given the prominence of digital health, EPF set up an internal working group to move forward on this. And again, one of the main outputs of this working group is actually a specific briefing looking at the whole area of health data and responsible data sharing. And finally, we've done a lot of work more recently on electronic health records and what the ideal health record would look like from the perspective of patients and its role in relation to data sharing as well. So what is actually the value of health data for patients? It's multifaceted. Improving quality fundamentally as a basis and evidence base for shared decision making at individual but also at collective level, and actually looking at a participatory care process. When it comes to health systems, it's about sustainability, looking at better health outcomes, more effectiveness and efficiency within health systems, and reducing waste. It's looking at integrated care and how to actually implement integrated care in a meaningful way, looking at person-centred, well-coordinated, joined-up, interoperable care. And of course, last but certainly not least, patient empowerment. Patients to actually collect and use their own data for that to contribute to self-management and indeed quality of life. There are a number of challenges linked to digital health, and these are just some of them. The whole issue of digital health literacy, not just for patients, but other users like healthcare providers. Accurate needs assessment, what are the gaps out there and how can digital health and technology respond to those needs? How to really embed the user through the life cycle of the development of digital health, the affordability of digital tools, who actually pays for them. And is there a risk that actually digital health will undermine that quintessential relationship between patients and their trusted healthcare professionals, so undermining that human factor? The Commission's communication on digital health tries up to a point to respond to some of those challenges. We were relatively pleased with the narrative linked to the communication because it is embedded in the notion of patients and citizens empowerment. There are 3 pillars to the communication: securing access to and sharing of data, looking at access as a citizen's right, cross-border patient summaries, e-prescriptions, looking at really progressing on usable, fit-for-purpose electronic health records, citizen-centred healthcare solutions and services, looking at common principles, certification, mobilising public funding, with a real emphasis on the continuum of care. And then pooling of data for effective and efficient research, voluntary collaboration mechanisms, for instance, the 1 million genome by 2020 initiative. Those are all beautiful words, of course, and we need to look at implementation. And I think the Commission in this sense has got it right, because there are dedicated projects looking at how to translate the principles and ideas within the communication and the commitments therein into practice. And one such project is Digital Health Europe. And really, EPF has been involved in quite a meaningful way in a significant consortium made up of experts from a whole rack of areas, really looking at proof of concept regarding digital tools that actually enable patient-centred care, looking at impact assessment, looking at actually how these could be resourced and funded, looking at effective deployment and capacity, building capacity for people to be able to use these effectively, and then that important dimension, moving from a pilot into actually something that can be replicated and scaled up, either within a national context or on a pan-European level. So far, so good. It's interesting in the way that the patient community has been taken on board and participating effectively in quite a technical project. So coming back more to the grassroots environment, data, empowerment and self-management. Self-management roughly is taking control of one's own life. And it really does start with one's own data in an understandable format and language. So my data, easily, freely, routinely accessible to me, and ideally a co-owned, interactive, interoperable record. But at the moment, it's very, very patchy. EU patients don't have routine access to their own health records. Access to one's own health information in understandable language, we see, from the patient's perspective, from the 150 million patients with chronic diseases in Europe, as a basic citizen's right and really a precondition for patient empowerment, shared decision-making and collaborative care. So looking at a patient of the future, Sarah, who actually is living with Parkinson's disease. To manage her Parkinson's disease, Sarah spends about 1 hour with her neurologists and 8,756 hours in self-care. And I think her statement speaks for itself. I'm not saying that I want more time in healthcare. I really don't think I need more time with my neurologist. However, I am saying that healthcare professionals and researchers need to acknowledge the work that we patients do in self-care, and also start to work on making use of our observations for their own knowledge building, their own work. Just imagine what we could do, what we could achieve if we started to work together as equals with different but complementary areas of expertise. So co-creation to really advance the agenda on health data, both at individual, I think, and also at political level as well. So using data to improve the quality of care, to make informed decisions, patient carers and healthcare professionals need data as an evidence base on what works but what could work better, in addressing unwarranted variations in care, in measuring and comparing the right processes and outcomes. And of course, communication skills are vital. Shared decision-making is all about dialogue. And there needs to be more decision aids to actually explain the data that we're discussing. Shared decision-making is still far from being embedded in healthcare practices across Europe, and patients' choices and preferences are not always respected. And this actually is something that can't be delivered overnight. It really requires a profound cultural change, and also theory of change is really needed for this to happen. And EPF as an organisation has been doing a lot of work on patient empowerment, and major campaign back in 2016 with a big level of support from healthcare professional organisations as well to try and set the scene there. Looking at data use and reuse for health research, we had a fantastic, as I say, presentation on GDPR. In the work that we've done with our members in consulting them about GDPR and other issues linked to data, it's become apparent that patients are generally comfortable and willing to share their health data. They recognise the vital importance to advance health research, help other patients, ultimately benefit society. And this altruism comes from being a patient oneself, living with a chronic disease, a really serious condition, from actually benefiting from innovation and being part of a patient organisation or a community or a movement. But we should be very cautious here, and we should absolutely not be cavalier. And we know from working particularly with our young patients how serious it can be if there is a breach in the data privacy, confidentiality, security piece. Threats to longer-term education, employment prospects, housing, buying or purchasing a property, insurance, and the list goes on. So we really need to be very serious about this, but generally the patient's view is this is an important thing to happen. And this contrasts quite significantly from the general population's view on health data sharing, interestingly. Patients also must be partners in driving research, equal partners. Researchers often work in silos, and patients tend to be much more interested in integrating data to get a full picture. They're also impatient. They want to get something back now, not in 10 years' time when research results may be available. And this was central to our European Parliament election campaign, A Europe for Patients, highlighting that digitalisation of health must be a collaborative effort with patients and building around patients' priorities to bring real value for patients and for society. Once again, this message that digital health and technology shouldn't be just for the sake of it, but actually should be driving something forward for the good of patients and society. I'm going to skip these couple of slides because you can read them afterwards, and I've been told I've got 5 minutes left. I'd like to move to a brand new initiative that EPF is driving called DataSavesLives. It is a multi-stakeholder initiative really to look at raising wider patient and public awareness about the importance of health data, to improve understanding of how it's used, to establish a trusted environment for multi-stakeholder dialogue about responsible use and good practice across Europe, to empower patients and healthcare professionals to realise the potential of new sources of data and digital technology, and create the resources to be adaptable for use at national and local level. And the other piece is really showing real-life examples on how data is used for the benefit of patients, to really bring it alive and stop it being simply an abstract, very complex topic to something that people really relate to in their daily lives. Our vision as the DataSavesLives initiative is a Europe where patients, carers and citizens are informed about and involved in responsible health data sharing, leading to trust, more effective research, improved healthcare and better outcomes. And our mission is essentially around building awareness and trust in responsible health data sharing through a state-of-the-art European health data portal targeted towards patient organisations and their members throughout Europe, and multi-channel media resources to support this. We need to acknowledge that there are a lot of materials out there in English, actually focused and targeted towards an English-speaking audience. And we need to actually fill the gap and make sure that patients and citizens in other parts of Europe are really able to access sort of information that they need to make informed decisions and reflections about health data sharing. There's also the need for a health data community to foster meaningful dialogue, knowledge building and insights on health data in a European policy and practice environment. There's still a lot of debate, discussion, and I think we heard earlier, the implementation of GDPR, it's at different stages in different parts of Europe. We're coming across some real bottlenecks in certain countries, and it's very, very important that the entire community understand and grapple with these issues, because it's only by doing that in a safe space and really discussing in a very open and evidence-based way can we move forward. And it isn't just an issue for the Commission or the Parliament or the Council or national government. I think all of the stakeholders have a lot to say on these issues. And also to try and build a network of health data ambassadors at national level to promote responsible use of health data. And I think responsible is a key word here. We're looking to try and build this network and encourage organisations to get involved. And why join us? Why join the DataSavesLives initiative? We'd really like to co-create this go-to portal for patients and the health-interested public on health data, to contribute to the content and to the debate through the lens of national or European communities, to obtain insights on the state of play regarding data legislation, its policy, and soft policy at national level, and an understanding of the landscape and the views of fellow stakeholders, and to help craft a major campaign to really shift minds and hearts on responsible data sharing. So in conclusion, I think it's fair to say that there's an increasing drive to improve collection, sharing and use of patients' data for more sustainable healthcare and research in the future. Digitalisation will transform our health systems, and patients want a person-centred system where technology and data brings real added value. That needs to be really front and centre to ensure that the right sort of buy-in, trust and acceptability. And this trust, confidence and responsibility, acceptability is very much the rationale behind DataSavesLives, and it will be launched actually at the EPF upcoming Congress in Brussels in mid-November, so watch that space. And finally, meaningful patient participation in developing technologies, data governance, implementation, evaluation, policy and research is really absolutely key. And by doing that, we move away from the rhetoric of patient-centred care to a real participatory, collaborative partnership. I'm aware I've gone through a lot of this quite quickly, and I just wanted to end with a few links to some of our resources and so on that you can find on the EPF website and through our social media. Thank you very much for your attention.